Hey guys, welcome back. All right, we're coming with me now over to lesson 2. That's going to be page 46 in the big book. Our learning objectives for this lesson. After completing them, you should be able to identify common symptoms associated with hearing loss. We're going to talk about hearing loss. We're going to recognize signs and symptoms of hearing loss and changes of conditions in the baseline. We're going to recall when and to who we are going to report if a client's hearing ability changes. And we're going to use some strategies to communicate with the client experiencing hearing loss and to overcome difficulties with communication. So you will encounter clients who have hearing loss in your career to come. It's going to be a very common thing. It's age, uh, uh, employment factors, things that you did for a living, lifestyle, the way that you lived your life. The things you choose to surround yourself with. All of those can impact your hearing, and it can affect hearing loss. So it does happen quite frequently to some degree. Now, some key terms we're going to talk about. We've mentioned this term before, but the baseline, okay? The baseline is a key term, and that basically means what is normal for the client. What is their usual condition? What is to be expected from them in terms of whatever it is you're measuring? Disability is an impairment that requires modification or assistance with a task or a function, and these can be permanent or temporary, of course. Disorder. A disorder is a medical condition that causes an impairment in the mind or a body. Oftentimes, the cause of a disorder is very different than what caused a disability. Hearing loss. That's a decrease in the ability to hear sounds, deafness. Turn up your volume. There you go. Got it. All right. Yes, that's deafness. And then impairment, an abnormality or a partial or complete loss or the loss or function of a body part, organ, or system. And usually when we talk about an impairment, it's typically something that happens to that organ or that body part or that system. Not necessarily something you're born with, but there's always variations to that. So we'll get into the meat and potatoes of that here in a second. The overview is that some clients live with conditions that make communication more challenging. And as a long-term caregiver, part of your responsibility is watching for changes in these conditions. Your job is to observe and report, help as much as you can when possible, and just be an advocate for the client. You need to be familiar with common conditions and understanding these conditions, which will help you to prepare with the communication and the challenges associated with it. Over with me now to page 47. First, we're going to address hearing loss or impairment. According to researchers, about 25% of people over the age of 65 and 50% of people over 75 have a disabling hearing loss. And by disabling, we mean it's hearing loss to the extent that it interferes with their day-to-day life. It makes things that you and I may take for granted as easy, challenging or difficult for them to do. Now, some people are born with a hearing loss or an impairment. And for those people, they acclimate to it as children, and they, live rich, full lives, and they do everything. And it's not a burden or a challenge to them because they've been living with it for their whole life. But where it becomes difficult is you have a combination of somebody who has lived their entire life as somebody who is actively able to hear just fine, and then they get into their later stage of years where learning new skills and abilities is challenging and difficult. And then they get hit with, guess what? Now you have to figure out how to function without a working pair of ears. And this can be really hard for somebody who doesn't really know how to learn new skills and aptitudes. It's like, little kids when they're learning a new language, right? They always say it's the best time to teach a kid a new language is when they're young because they're so spongy and so adaptable and they can just pick up things quickly. The older people get, the harder it becomes for them to learn new skills, new abilities, new technologies, things like that. It's a common thing that people complain about. At least that's what my dad tells me. Now, studies have linked this loss of hearing to walking difficulties, falling, and social isolation. And this is very important to caregivers to identify when someone's experiencing hearing loss, because that can explain why these things are occurring. The hearing loss can then affect the inner ear, and then the inner ear is what maintains your balance. So if you can't hear correctly, if you've ever been sick and you've got really bad congestion and your ears closed up and you can't hear, it feels like someone's got a finger in your ear, you'll notice that your ability to walk or your ability to be, not dizzy or fall has been compromised. So I've gone through that. I know I felt that. I know that my wife has, and my dad has. A number of people that I am close to have told me they've experienced that. So it's a really common thing, and it's a good experience of what it's like to experience hearing loss. Reporting guidelines. To effectively report changes in a client's condition, observe their physical and cognitive ability and compare it to their baseline, or what is normal for that person. Remember, I'm not saying what is normal to you. It's what is normal for them. And to know what's normal for somebody, don't you have to kind of get to know them a little bit, right? So it's kind of hard to really judge on a baseline when you first meet someone on day one. But as you work for them for maybe a couple of weeks, a couple of months, you'll get to feel what their baselines are, and you'll be more adequately prepared to identify changes in them. So remember, the baseline is not something you're going to know right away. Now, good sources of baseline information are things like the client themselves, asking them questions. Their care plan should have some information about their baseline, and other members of the care team. You can ask them, like, what time does Mrs. Jones usually wake up? Or, she seems to not be eating that much lately. Is this common for her? Ask other members of the care team, and they oftentimes can tell you. You should report whenever the client develops a new problem or has a personal care need not being met, and it's an instance where you feel like you're concerned. Like, this should be done, or they shouldn't be doing this, but they are or aren't doing it. And so you're like, okay, I better report this. You don't report every change in the baseline. Like if they wake up at 9 instead of 8, or if they go to bed at 11 instead of 10, that's not really a big deal. But if it's something that becomes your concern, like they're going to bed at 3 in the morning instead of at 8 at night, like they usually do, and then they're sleeping all day and waking up at 2 when they normally get up at 8, have a nice breakfast and go for a walk, that's a change in a baseline that could be concerning. That could indicate something else is wrong with them, right? So use your good brain. There's some more information about the care plan on Module 5, which we'll kick over there later. Now, possible signs of hearing loss or a change in condition from the baseline. Some things that may show a change in condition are they increase the volume on their audio and video devices. They're cranking up the TV remote, or they're listening to headphones and you can hear those headphones from across the room, even though they're supposed to be noise canceling. All right? Or they yell, or they want you to yell when you're talking in a normal tone of voice. Ringing in their ears, that that tinnitus sound, or that eerie ringing that comes and goes sometimes, or sometimes goes all the time. Asking you to speak loudly. Being non-responsive to sound, like a knock at the door. They don't do anything. They don't answer. The phone rings. They ignore it. You're like, you going to get that? Oh, I didn't even hear it ring. Things like that. Not being able to hear your voice, or hearing certain sounds, or being able to distinguish sound with background noise. That's another thing, that when you have hearing loss or hearing impairment, it's tough to make out what someone's saying in a room full of people. I experienced this myself. I've got a little bit of hearing loss myself. And when I'm in a room full of people and someone's talking to me and everyone else is talking, sometimes I'm just like, I'm sorry, I can't, what'd you say? It's hard for me to hear. It is. And I experienced that myself. So I can personally say that's a rough one. Misunderstanding communication, basically I heard you wrong. It's because my hearing's not all that great. I heard you wrong. Requiring somebody to repeat something multiple times, or slow it down, or say it a little clearer. That way, like I was saying before, they watch your lips while you talk and they can hear what you're saying, but also sort of use those context clues. Acting withdrawn, okay? If you can't hear what people are saying and you feel like you're a burden to the conversation, sometimes you'll just say, you know what? I don't want to be a part of this conversation. I don't want to be a part of this social situation. I don't want to go to this party because there's going to be a bunch of people there. I'm going to try to talk to people. I won't be able to hear them or understand them. They'll get annoyed with me, right? And is it kind of natural to feel that way? I think it is. I think if I had a hearing impairment where it was hard for me to have a good conversation with people, and then you said, hey, come on to this party with me. Let's go hang out. I'd be like, yeah, no, I'll pass. I probably would, because I wouldn't want to go to a place where I didn't feel like I was part of the group. Missing parts or whole words, only pretending to understand when spoken to. This is a deadly one. You got to watch out for this one, man. You'll ask somebody a question. You'll be like, oh, so what do you think about this? I like it. I like it. So you like the idea of getting set on fire? No. What did you say? And I said, no, I heard about this guy and he was, pumping gas in his car and he got set on fire. And I said, what do you think about that? And you said you liked it. And they're like, oh, I know, no, I don't like it. But they'll agree to things, even if they're ludicrous sometimes, because they don't know what you just said. Think about some funny examples of that. Let's talk about that in class. I'll be right back. Pause and we'll come back. All right, so we're back. Hopefully you thought of some good examples of that. We can talk about those in class because some of them can be a little bit funny when you think about those instances. Now, some other things that may show you that some hearing loss is occurring is when they're unable to hear you on the phone, or you hear them, on the phone with somebody and they keep on, can you speak up? Or they put the phone on speakerphone all the time. Like every time they talk on someone, they can never use the phone regularly. They always have to put it on speakerphone. That's another one. Not being able to hear somebody in another room, not being able to hear timers or alerts, struggling to follow a conversation, or, like I said, not hearing things around you like knocking on doors. So there's a lot of instances, but most of it's pretty common sense. If it's something that you hear and they don't, that's an indication that something might be going on here. They might be having trouble hearing. So think about a few of those. Let's go ahead and pop over to the next page now. Page 48. Boop. Now, problem-solving hearing loss or impairment. So this is how we kind of sort of help to fix when there's a problem. And I don't mean fix their ears, but maybe fix things that'll make it easier for them to hear. When you or your client notices signs of hearing loss or impairment, there's a few things that you can do to help. One is you can note if they're wearing a hearing aid. Is it on? Check to make sure it's on. Check to make sure that it's operating and that it has batteries. Okay. You can if they can take the hearing aid out, you can actually hold it up to yourself and you can hear if it's operating by hearing sounds around you, and it'll transmit those sounds. You'll be able to hear them clearly through the hearing aid, so you should be able to tell if it's working. Review the service plan to see if there's any temporary or permanent hearing loss of the client. They may not remember that they have hearing loss, and so they may tell you that they don't know why their ears are the way they are, but the care plan may say that for the last 3 years, they've been complaining about this hearing loss. And so you'll be like, okay, this isn't a change in the baseline, but maybe there's some tips on how to help them here. You can check when they were last examined by a medical provider, because a lot of times their hearing loss doesn't really have to do with like damage to the ear itself. Many times there's an obstruction. There's a buildup of dirt or wax or something that just hasn't been cleaned properly, and it's accumulated over the last 2 decades. And maybe they just need to see their doctor, get their ears checked out, and get cleaned out a little bit. And, yeah, works wonders. So sometimes a simple fix is all that's needed to help this. So have them see their doctor, and then discuss some observations with the client and the care team, so everyone's in the loop. And then the next person that comes along, they know that the client experiences hearing loss, so it's no surprise to them. We're all a team. Even if people aren't on your team yet, you're still on a team with them. Does that make sense? You're not part of your care team yet, but the people who are on your care team now that you will be on, you're part of their team, and they need to be thinking about you and future you. Now, assisting clients with hearing loss or impairment. Use hearing assistive technology like hearing aids. That's something that a lot of clients will do when they have hearing loss, and they're pretty effective. They work pretty well. You can refer the client to captions on phones or TV. One thing that clients will be relying more and more on instead of using a phone is texting. Texting it's pretty efficient. I like it. I would actually prefer to text than make a phone call, but that's got nothing to do with my hearing loss. It's just I like the freedom of being able to just answer a question and then get back to what I was doing and then answer another question instead of having a conversation back and forth with someone, but that's just me. Slow down the conversation and focus on one topic at a time. So adjust your speech a little bit, maybe. Think in terms that the person has trouble following the conversation, and that if you slow it down just enough so they can follow your words, they can catch up and be more comfortable with what you're having saying. Then you can identify background sounds and try to eliminate them. TV, done. Radio, neighbor. Well, we're not going to do that, but go away, neighbor. Anything that's obstructing their hearing, anything around them that's causing them to not be able to hear well, that you've got the ability to control or mute or lower the volume of, then by all means, knock those out, get those done. Encourage the client to request others to change their behavior. Like if you're doing the things that need to be done, but no one else is, then maybe cue other people in on the things that they should be doing to help them understand and hear better. Maybe tell their mother, hey, your son actually, he seems to respond really well when I sit to the side of him and I speak to him at eye level instead of standing up and talking down to him. Things like that, right? You'll play detective, you'll play investigator, you'll find things that work. Everybody's different, so I can't sit here and say do this or do that. All I can do is just lob ideas at you, and then you take what you want, put it in your toolbox, and then later on go, hey, I remember he said try this. Let's try this. All right. Communicating with clients who have a hearing difficulty. Some ways you can do this are by getting their attention physically, by tapping them or waving, maybe elevating your voice a little bit and saying, hey, John, say their name a little louder, then maybe they respond to that. And then once they turn and they give you their attention, then you can talk to them normally. Face them directly and keep your hands away from your face. Remember, this is the bane of the face mask. When your mouth is covered, it's harder and harder to hear what someone's saying. Even though you can hear it, it's just the mouth combined with the words heard, it just helps them understand better. Make sure there's enough light so the client can easily see your face. Speak slowly and carefully form your words. Enunciate and let your lips be conscious of the fact that they're looking at your lips. So make sure you emphasize the words you're saying with your lips. See that? See what I'm doing there? If I just talk normally and blah, 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 it's different. But when I slow down, you can see the expression of my mouth, right? So try that and keep it simple. Don't overcomplicate what you're trying to communicate. Just say what needs to be said and they'll understand it. And this is someone who has total hearing loss, but they're good at reading lips, especially with those folks. Keep the background noise down. Use gestures and facial expressions to sort of explain yourself or to emphasize what's being said. Like if you tell a client, now, okay, that's fine, but you can say, now, or now. You know what I mean? That lets them know that it's urgent. We got to go right now. We're late. Any kind of things like that you can do. Come up with little ideas or ways you can communicate things other than just saying the words. Make sure that they understand what you said and try not to, be chewing gum or eating anything or having something in your mouth when you're talking, because that's distracting. And also that limits the lip and mouth movement that they're relying on to see what you're trying to say to them. Now, some more information is available at the Hearing Loss Resource Directory in the back of the book, which we'll discuss that later in class. So now go ahead and jump over with me to page 49. Making good progress. Some difficulties with communication. How do we overcome these difficulties? Well, difficulties with communication can be caused by a lot of factors. They can be disorders that occur naturally as their life progresses that have nothing to do with what they did. There can be injury, like they get hurt or injured or something happens to them, or disease, which again can occur naturally throughout the lifetime and it's, got nothing to do with their actions. These make communication and understanding more challenging for the client and the caregiver. To help them overcome these challenges, you need to be patient, you need to be flexible, and use your good communication skills. Okay? When their communication skills falter, yours have to rise to help them to rise. You got to meet them and help them to sort of meet you. All right? It's where you got to be strong. When one of us is, I need help, the other person is, I can help. You know what I mean? So you're going to be the helper here. Some difficulty speaking. If somebody has trouble speaking, not hearing, but speaking, this is some things you can do to help those folks. One thing you can do is, again, you can reduce background noise and confusion. Okay? It'll help if there's nothing going on in the background. It'll help them to hear what's being said and then respond appropriately without thinking about that TV is really loud or, man, that person's talking really, maybe I should wait for them to stop talking. So helping them communicate is also reducing background noise. Asking questions in a way that lets people respond with a simple one-word answer, or maybe by nodding their head, or by a hand gesture, right? So if you know they have trouble communicating, just keep your questions simple to things. Imagine that you're feeding your client and there's got a mouthful of food. What kind of questions would you ask them in that instance? If your client has difficulty communicating, think about yes or no questions as opposed to questions that require an explanation. All right, so there's some good examples, and we'll talk about those later in a skill we do. But for now, let's take a quick break, and we'll come back and we'll finish up this little part. Okay, so we're back. Now, the next thing you want to do with someone who has difficulty speaking is to give clear choices, but not too many choices. Oftentimes, someone who has a verbal impairment may also have a mental impairment. They may have trouble processing a lot of information at one time. And so then to regurgitate back an option from among 9 or 10 options is going to be a little too much for them. Keep the dialogue trees small. 1 or 2 choices per dialogue tree. Do you want to do this or do you want to do that? Okay, we chose that. So then because you want to go to the park, do you want to go now or do you want to go later? Okay, you want to go later? All right. So if we're going to go to the park later, what should we do now? Should we get your laundry done or do you want to have lunch? Keep the dialogue tree small so they can make 1 or 2 choices as opposed to making multiple choices. Okay, makes sense? Give them plenty of time to think and understand. This is one I do with my father. Be patient. If you ask a question and then sometimes they'll just need a minute to process it and they'll need a minute to think about their answer. And that's not an indication that they have any kind of impairment. Sometimes they just are a deliberate person and they like to think about their answer before they make it. So in all cases, hearing impairment, verbal impairment or not, just be patient and let them answer in their own time, just like you'd appreciate someone doing with you. Watch their lips or gestures to help understand the message. Be patient. Ask again if you don't understand what they said. Visual cues are helpful, so have a paper and pencil with you at all times because maybe they'll want to write something down. Maybe they'll want to draw a picture of something. You never know. Limit the length of the conversation so the client doesn't get tired of talking. And if they become frustrated, just maybe put a pin in the discussion and say, you know what, this doesn't have to be talked about right now. Why don't we finish up doing what we were doing before and we can come back to this conversation a little bit later. Be understanding and be patient. And then finally, don't you pretend to understand either. Don't be like, oh yeah, I got it. Because later they may ask you something related to what was said. And if you don't know what you're talking about, they're going to know you weren't listening. So don't pretend to understand what they said. Huh? Now, there's something called cognitive impairment. That's another communication difficulty. That's over at the next part of page 49. Cognitive impairment, that one is one that can affect your ability to send, receive, and understand messages. It's got very little to do with the ears. This is all the brain, how the brain takes it in, how the brain processes it, and how the brain provides feedback to it. In order to help people who have cognitive impairments, who may feel angry or anxious or depressed or have bad self-esteem because of this, speak slowly in a calm, slow, low tone of voice. Okay? Again, we're not baby talking. We're just talking in a way that's easy to understand and shows that this person needs time to process. But I'm not speaking in a disrespectful manner. I'm just slowing my tone down and making it softer and easier and more palatable to hear. Right? Okay. Like I said before, 1 question at a time is good. Keep that dialogue tree short. Don't get into a bunch of details. And use concise positive statements and phrases and simple 1-step directions. Okay? 1 thing at a time. You can demonstrate how to complete a task. Like later when we do the skills in the classroom, you're going to see that a lot of the skills we're going to do, we actually are going to sort of show the client what we are going to do before we actually do it with them. And when we're doing the skills with the clients, we want to encourage that client to do as much as they can on their own too, not we do everything for you. So that's going to be good. You demonstrate it for them, and then they actively participate in as much of that skill or activity as they can. If you don't tell them what you're doing and you just start doing it, they're just going to assume, okay, I should just sit here and let them do it. And that's not productive. Provide cues, reminders about things or things like, hey, in a half an hour, we've got your doctor's appointment. We should start getting dressed. Stuff like that. And then reinforce information with pictures and visual images. Include the client in conversations about them. Never talk about the client in front of the client as though they're not there. You know, what do you want to do with Pop? Pop can't stay here. You know, things like that. You don't talk about them as though they're not there, right? And then remember, someone who has cognitive limitations is also sensitive to body language and tone. So control your negative emotions. All right, that's a good little place to take a break. Let's flip over to page 50 on the next one. Okay, that brings us to our next part, which on page 50, we're going to discuss dementia. Okay, dementia is another cognitive learning disability that makes it hard to understand or maybe communicate or hear what's being said or process it. We're going to talk more about dementia in the Dementia Level 1 class that you're going to be taking later on. We do a whole class about dementia. It's pretty interesting. I think you'll enjoy it. But for now, we're going to touch on dementia. Dementia is caused by a disease or an injury or an illness that damages brain cells. Dementia itself isn't so much a disease as it is a condition. It's something that occurs because something happens to the brain. And dementia, obviously, like many disorders or conditions, has different layers of severity. As dementia advances, the communication will become more challenging, as well as many other activities. Dementia requires patience because the person that you're working with may not remember you. You introduce yourself every time you approach them. Wearing a name badge can be helpful for someone who needs a little help remembering your name. Now, one other thing I found working with dementia patients, wearing something that has a significance to the client will help a lot, because many clients who have dementia and who are in later stages, they're seeing a lot of people. They're having a lot of care people come, nurses and doctors and visitors. They have people come and go, and those faces just become a blur to them. They can't remember people. But if you know that your client loves a specific football team, for example, maybe they really like the Buffalo Bills. Okay, cool. Maybe you find a Buffalo Bills pin and you wear it every day to work. And that client, they might not remember you, but those deep-seated memories of their favorite sports team, those are going to stick around for a while. And they'll remember that you're the guy that shows up that wears the Buffalo Bills pin. Hey, you're the Buffalo Bills guy. They won't remember you, but they might remember that pin, and therefore that brain will make that important neuroconnective pathway and say, oh, this is somebody I actually know. This is someone I remember. I can trust this person. And when these later stages of dementia hit, having people you can trust is more than gold. It's worth more than anything, because you get scared and you get paranoid when suddenly you can't remember anybody, right? Wouldn't you? If you didn't know anybody and you had these strangers walking into your house and you're like, that'd be scary. That would. So put yourself in their perspective and try that approach. That always worked for me. I wore like a hat sometimes, or I had like a certain Hawaiian shirt I would wear every single day, so they'd get used to seeing me in just that thing every day I worked with them. It was like almost like a uniform I would wear, right? Okay, so they may not know where they are or in what part of their life it's in. Don't obsess about times with folks who have dementia. Don't be pushing, it's 8, it's 7, it's 5:15, it's a Tuesday, it's a Monday, it's Labor Day, it's Martin Luther King Day. They're not going to worry about or even remember or care about days or times. But the instances of things that have to take place in that day, it's time to take a shower. It's time to have breakfast. Hey, it's time for your favorite TV show. That's the kind of things that they'll want to hear and that they'll be able to sort of appreciate and understand being communicated to them. Not so much the minutia of the exact details of them. Focus your conversation on their reality, and reorienting them to your reality will just cause more confusion or distress. You cannot force a reset of their brain. It's not like a Nintendo cartridge that you can just take and you blow on it, and that shows you how old I am. You blow on the Nintendo cartridge and you put it back in, So work with them. Don't force them to work with you. They may tell you the same story or ask the same question repeatedly. Be patient, and like I said before, understand these things are important to them, so let them say what they need to say. It costs you nothing. Show them that you're listening, be an active listener, like we talked about. And pay attention to their feelings and their emotions. Use your senses to understand what they're communicating. You know, you're a detective, you're an investigator. A person with dementia will be extra sensitive to feelings, emotions, and nonverbal communication. Okay? What you say will oftentimes go in one ear, whoop, and out the other. But what's on your face or the way you said it will stick with them because that's an emotional feeling. That'll hit them in the heart. And that sort of thing lingers. You know, words spoken in anger, they might even remember the words, but they'll remember you yelled at them. So think about that and think about being the kind of person that wants to, be a good caregiver to people and treat them well. All right, we're going to take a little break here, then we're going to resume with the last part of this module. See you there.